the Ministerial Advisory Committee on COVID-19 is recommending now that the quarantining of contacts must be stopped. In a letter to the Health Minister, Dr. Joe Phaahla, the committee recommended that quarantining is not viable in the current social and economic climate. For a reaction on this, I'm joined now by Dr. Sipho Dhlamini, an infectious disease specialist at UCT. Dr. Dhlamini, good to have you with us on the Daytime Update today. Perhaps let's start with the scientific reasons why contact tracing and quarantining were put in place right from the start.
Hi, good afternoon, Tommy, and good afternoon to the viewers. No, thank you. I think we welcome these statements by the Advisory Committee and then, the Department of Health about their thinking about quarantining and isolating. Remember, in the beginning, the whole purpose of quarantining and isolation was to try and get a control of this viral infection, so to limit the spread of the infection throughout our communities. And since wave one, to the current position, we've learned a lot about this virus and how it spreads. And two, your viewers will know that we've had the different variants as well, and our understanding of how they spread also kind of has differed, meaning that our initial strategy at containing this virus needs to change. And one of the things, of course, is that it's clear that the quarantining and isolation sort of guidelines have not helped contain the virus. There is data to suggest that there has been a lot of community spread of the virus, just looking at some of the seroprevalence surveys that are done by the national authority.
What does this then mean, in effect, Dr. Dhlamini? What is it that we know now about the way that COVID-19 spreads that we did not know before? The assumption was that if you have been in contact with somebody who has the virus, then the likelihood, because it is airborne, the likelihood is that you yourself may have inhaled it or contracted it in some way. Does that change at all?
So, no, I think it remains the same. But remember, in the beginning, there were debates about whether it's just purely droplet or airborne. And it's quite clear now it's more likely more airborne than droplet spread. And meaning, remember, with the droplet spread, that's why the guidance was 1.5 meter to 2 meter social distancing. It's very different when it's an airborne spread, because that 1.5 to 2 meter almost doesn't help you, and hence the use of masks is quite important. So I think we've learned a lot. And remember, with the current Omicron variant, we also know that it's highly transmissible, which again changes how then you public message and deal with the virus. But importantly, I think the other thing is, of course, as the vaccination rates increase in the country, that may also introduce its own dynamic in terms of what we do.
You've spoken about the vaccination rates, and one of the goals was to ensure that there is herd immunity. Have we reached that? How far are we towards reaching that herd immunity?
I think the issue of herd immunity probably now is an unavoidable issue, because we know that even if you are vaccinated, you'll get breakthrough infection. So there's not going to be 100% protection. But what is clear is that the vaccination protects against hospitalization and death. And I think that's what we are really trying to focus on, is that even if you get the virus and you've been vaccinated, we want you not to be hospitalized, and we don't want to lose any more people to this virus. So that's quite clear. And I think the indications are that even with the current variant that is spreading, that people who have been vaccinating are having milder disease. And those who've had previous infection, because even previous infection does give you some immunity, are also having that. But I think the key message is that for people to get full protection, they need to be vaccinated. And I think that's the key message. So we still are insisting as a public measure that people vaccinate, and that the isolation and quarantining rules that we previously had are probably ineffective in terms of containing community spread. I think people should just recognize that they are being exposed to the virus out there.
Dr. Sipho Dhlamini, infectious disease specialist, thank you very much for that. A change of tactic there being suggested for the containment of the spread of COVID-19, as he says. That's herd immunity no longer an issue, no longer the goal. And with the rate that Omicron is spreading and the fact that so many are actually asymptomatic, carrying, COVID-19 within them, but not showing any signs. So he, in agreement with the decision and the recommendation made by the Ministerial Advisory Council that contact tracing as well as quarantining for the 10 days, which was stipulated, no longer be a prerequisite.